We've spoken so much about joint issues, joint diseases. Lectures on it was virtually back to back. All right. So now I want to actually talk about one test that could be done. Like if there's an inflammation in the joint, you are doing a synovial fluid analysis. This is because you want to actually pick up what is actually causing that issue at the joint. Okay. So synovial fluid analysis, it can help you pick a lot of things which will be listing out in this lecture. So this is how it looks like. So directly they have to actually put a needle right there, draw some synovial fluid, send it to the lab for analysis. So synovial fluid analysis, so that is a diagnostic test, is used to evaluate joint health. You want to examine the fluid that is lubricating the joint, the fluid that is cushioning the joint. Of course, if you examine the joint, the fluid, it can be able to help you pick up maybe some microorganisms and all those, So so it's especially useful for identifying causes of joint pain. It will help you to know why your joint is swelling. It will help you to know why your joint is inflamed. All right. It will help you pick up infections. It will help you to know if there are crystals. There's composition of a particular mineral that is not nice. Okay. It will also help you to pick up if your immune system is the one that is what? If your immune system is the one that is fighting the own body. So what is examining the fluid? You want to check out the appearance of the fluid. Is it clear or is it yellow? White blood cell count. So the more white blood cells you have in the fluid, you know that white blood cells are being recruited to fight infections. Do you understand? Red blood cell count may be present in trauma. If red blood cells are actually like bleeding, if blood is bleeding into the synovial fluid, it confirms that there was a trauma there. Alright. So crystals. So you can also dictate crystals like monosodium urate, calcium pyrophosphate, dictated using polarized light. Alright, you can also use it to do gram stains to identify the bacteria, glucose and protein levels, lactate dehydrogenase. Do you understand? So lactate dehydrogenase, if it is high, it just indicates that there's inflammations. Okay, it indicates that there's damage or inflammation. So why is it done? You can use synovial fluid to dictate a lot of or diagnose a lot of knee joint issues like septic arthritis, gout, pseudogout, rheumatoid arthritis. Okay, so you can also use it to rule out serious conditions that may need urgent treatment. Sometimes it's used to monitor known joint disorders. Okay, so how is it performed? So a procedure called what? You trying to extract synovial fluid from here is called arthrocentesis. Okay, so you withdraw fluid from the joint, usually done in the doctor's office with local anesthesia. You send the sample to the lab. So whatever result comes back is actually what will direct further treatment or further testings that might actually need to be done.